Bree and Jason, we're here at the Guam Memorial Hospital where just this afternoon, Governor Eddie Calvo announced the expansion of the emergency room and the critical and intensive care unit. And although this news is a sigh of relief for GMH, the hospital still deals with a multitude of problems, from finding an administrator to citations by JCO and CMS. And as we wait on word from the progress of these problems from the board and management at tonight's oversight hearing, here's a look at what's in store for the people of Guam. For many who have had to wait for a room or a bed at the emergency room, those countless hours worrying if you or your loved one will be given quality patient care have more to look forward to. Governor Eddie Calvo approved the formal contract to start the process to expand the emergency department and critical and intensive care unit at GMH. Calvo experienced firsthand what hundreds of island residents have had to endure and hopes this expansion provides a remedy.
Every time I've gone to the emergency room, and lots of time with my kids, most recently right before Christmas, and it was an emergency situation, it was an overflow, and that was in a slow night. What we're hearing here is there's going to be an expansion of space, an expansion of beds, and an expansion of not only in the emergency room, but also in the critical care unit, two areas where there is right now overflow in demand.
The Design Build Capital Improvement Project is valued at approximately $7.56 million and expands the emergency department from its existing 5,400 square feet to approximately 15,000 square feet, with the CCU-ICU expanding from its existing 2,500 square feet to nearly 8,000 square feet. GMH Acting Administrator Ray Vega says, although the hospital is dealing with a list of problems, expanding the emergency room was a priority the hospital had to fix.
By the nature of it, the emergency room should be ready at all times, and we've seen overcrowding there because of the size from 54 to 150. So we're going to see some efficiencies.
Having served over 400 CCU-ICU patients last fiscal year, the plan calls for expanding from a 10-bed unit to a 15-bed unit to include 2 isolation rooms, and most rooms increasing in size to approximately 200 square feet as opposed to the existing 120 square feet rooms. The emergency department will have 2 state-of-the-art trauma rooms, 2 multi-purpose isolation and decontamination rooms, 12 state-of-the-art monitored examination stations, among several other additions. Meanwhile, during this evening's oversight, Committee on Health Chair Senator Dennis Rodriguez says from the hospital having to close down its hemodialysis outpatient services to proposing a 32-hour work week, he hopes the financial challenges and several other issues plaguing the hospital will finally be resolved as we start this new year. He expects to hear a plan regarding the hospital's accreditation status, an issue most pressing for him.
I think we've expended so many resources, so many time and effort to getting to where we're at today. And so, you know, it's imperative that we know that the hospital is going to strive to maintain, to keep this accreditation. We're looking at what their strategic plan is. There's also talk about austerity measures, the 32-hour work week that they're planning to implement. These are things that I would like to know about, and I'm sure the public would like to know. And most importantly, I think with this oversight, it will give the opportunity for the employees here who would just hear whispers about it to know exactly what the details are of this plan.
The GMH board, meanwhile, will meet on Thursday evening where they will discuss the administrator position, which according to GMH board chairman Lee Weber, no one has applied yet. We'll have more on tonight's oversight hearing on KUAM.com.